Hello everyone, welcome back. We started talking about what to do if you don't have any health insurance and how to survive this difficult economic environment we live in right now. I told you today we're going to talk about the medical supplies and how you get them uh, and how you can afford them for the least cost. Now, I'm going to ask a question, and if you would please write in the comment section what you think is the most expensive part of the medical supplies. And I include in that alcohol, swabs, lancets, insulin syringes, test strips, pen needles, uh, glucometer. What do you think is the most expensive part? I will give you a minute or a second to think about it, and then I'll tell you. All right, well, actually, the most expensive part are the test strips. Uh, and it's not even close. I mean, all the other parts, alcohol or lancets or pen needles or syringes, you can get them for a few cents uh, per strip and sometimes per item, and sometimes you can get them for even less than a cent. So it's not that expensive at all. But the one that is very expensive, comparatively speaking, is the test strip. Even the glucometer itself, which is the machine that one uses to check their blood sugar, the machine itself can be maybe $20 or $25 depending on the brand. But the idea is that this machine will last you 5 years or more. So it is a one-time cost of $20 or $25. But the cost of the strips per strip can be as high as $1.50 per strip, which adds up very quickly, especially if somebody's checking the blood sugar 3 times a day or 4 times a day. That can add to more than $100 per month if you were to buy the expensive brands. Now, what are the expensive brands? Well, one of the most expensive ones is the One Touch series, and Bare Contour is also very expensive. The AccuCheck and Freestyle are a little bit less expensive, almost half the price of the One Touch and of the uh, Bare Contour. They can be 75 cents or 80 cents, or in some cases slightly less. But still, that adds up quickly, especially if you're checking the finger stick multiple times a day. So, in my opinion, if you're not able to afford and you have no insurance, the best one, that's what I would do, is to go to Walmart and get their RelyOn brand. So the RelyOn glucometers are surprisingly accurate compared to the price that you pay for them. Now, by the way, I don't have any financial disclosures or any conflicts of interest or whatever. And that applies to all the talks I'm going to give, by the way, with any pharmaceutical company or any supply company or Walmart, of course. But to let you know the truth, the glucometer that's called RelyOn of Walmart is surprisingly accurate, and the test strips is surprisingly cheap because it costs 18 cents per strip or less. And it's more affordable when you buy in bulk, but that price is very good, as good as you can get for a test strip that actually works and give you somewhat of an accurate reading. There is no doubt the One Touch and the Bare Contour are going to be more accurate, but you have to sacrifice something. So maybe you're not getting the Cadillac of test strips, but you are getting a car that can get you where you want to go in an efficient and good way. So that's my recommendation for a test strip. The second thing I want to talk to you today about is the continuous glucose monitoring system. Now you might know or not know that or have not tried them, but continuous glucose monitoring systems are extremely good for managing and maintaining good control on diabetes. The reason for that is because they give you instant feedback of everything that you do, whether it is eating or exercise or lack of exercise or stress or whatever it might be. You can see immediately the result reflected on your continuous glucose monitoring system. There are two main ones. There are other brands, of course, but two main ones that we utilize. One is the Freestyle Libre, which is made by Abbott Company, and one is the Dexcom, which is made by Dexcom. I'll tell you a little bit about the pricing of each of them and what is the best deal out there. So for the Dexcom, there is the Dexcom G7 and doesn't require to have a transmitter, from a sensor to sensor or carried from a sensor to sensor. So that saves actually a little bit of money compared to the Dexcom G6 sensors, which are priced about the same as the G7, but there is the additional cost of a sensor that you have to move from transmitter to transmitter and that you have to actually change every 3 months. But the best deal that you can get on the Dexcom is actually the Dexcom that's sold over the counter, which is called the Dexcom Stelo, S-T-E-L-O. The G6 and G7 can be very expensive. So for a month's supply, one may pay hundreds of dollars in cost for the Dexcom G6 or G7 if they don't have insurance. But for the Stelo, it is about $100 for 2 sensors. Now, it's not great still, it's expensive, but much less expensive than what you would get with the G7 and G6. The Freestyle Libre, of course, has an advantage in that area because there is a deal that the manufacturer, that's Abbott, made, and basically they have a way to give a discount at the point of purchase. So when you go to a pharmacy and you want to buy the Freestyle Libre, and you will need a prescription for either the G7, G6, Dexcom, or for any of the Libre generations, basically, you will need a prescription for them. You don't need a prescription for the Stelo, Dexcom Stelo, because it is sold directly to consumers. But if you get a Freestyle Libre 3, for example, prescription, you go to the pharmacy to pick it up, and the prescription is for 2 sensors, then the company has promised that if you call a certain number and activate a certain offer, they will actually bring down the cost to $75 per month, which is basically $75 for 2 sensors of the Freestyle Libre, because each of those sensors works for 15 days. Now that is the best economic deal, best financial deal that you can get out there. Unfortunately, neither Dexcom nor Libre has a patient assistance program, and they do not offer patient assistance to those who don't have insurances, like some medication companies do. But at least we have that discount that the Freestyle Libre can apply at the point of purchase, and that makes it $75. That's the cheapest price, the least expense that you can get on a continuous glucose monitoring system. Now you may ask me, but still, this is way too much. I cannot afford to pay $75 every single month just for one item, which is the sensor. And I completely understand and completely get it. So the way that you can manage things in this situation is something I call the staggering plan. What I mean by this is that you would check with finger stick, let's say 2 or 3 times a day, as much as you need or as much as your doctor tells you to check. But every 2 months, for example, you would utilize one Freestyle Libre sensor. Now you can get it either by that deal I just told you about at the point of purchase at the pharmacy, or maybe you can get a sample, a free sample from your doctor, your physician, that you can utilize basically at home. The idea is that when you wear the sensor for a period of 2 weeks, it kind of resets things for you. You can get back on track. If you had lost track of what effect do different things that you eat or drink have on your blood sugar, that quickly brings you back to reality. And then you can adjust what you need to adjust, change the things that you know you're doing wrong, and learn not to do. And then after that, you can go through another period of time of maybe 1 to 2 months or more, where you are just checking the finger stick to make sure that you stay on track. And again, with the finger stick, you would utilize the Relion glucometer and strips, which is the least expensive deal out there, and that allows you the best way to manage diabetes for low cost, simply by doing this staggering plan. Now, one of the best times and most important times to wear that continuous glucose monitoring system would be during times where you know you're not going to have as much of a good control. For example, holidays. And I see a lot in January, people, or February, March, people who kind of fell off the wagon during the holiday season. Blood sugar went up astronomically. Again, even from the purpose of financial coverage, you don't want to have a high blood sugar. You might end up in a emergency of some sort, whether it be high glucose or diabetic ketoacidosis, that you end up in an emergency room and or end up admitted to the hospital, which has a tremendous cost that will be very difficult to deal with. So it's best to avoid that and stay out of trouble, both physically, medically, and financially, by just staying on track with those supplies in the way that I explained. Now, one last thing I want to say about blood pressure machine. And this is something often neglected. People don't think that blood pressure machine is important. It is very important. Blood pressure affects you in every possible way. If you have hypertension, it is silent, doesn't raise red flags for you, but it can affect all your organs. You need to keep your blood pressure in check. You need to see how different food items and different stresses of life and so forth affect your blood pressure. So it is a very good investment to buy a blood pressure machine that you would have, and it stays for a very long time, more than 5 years, sometimes 10 or 15. You don't need anything fancy. I know there are brands out there that have Bluetooth this and Wi-Fi that and call you by your first name or whatever it is. You don't need any of this. One very simple blood pressure machine is called Omron, OMRON. You can buy it from Amazon. I just checked the pricing on that. It's $35. It's battery operated, very simple, very basic model, and can last 5-10 years or more. So that's something important. Oh, just by the way, one very important thing I forgot to mention about that Omron: buy the one that wraps around your arm, not around the wrist. The one that wraps around the wrist is notoriously bad and gives wrong readings. The one around the arm is much better and consistent. And I hope this has been helpful. On the next episode, we'll talk more about the medications and what to do in order to afford your medication, even if you don't have any insurance. And until then, have a great day.